Hello, my name is Brene Bent, a student in biomedical engineering at North Carolina State University, and today I will be discussing an application of neural engineering, the miniaturization of cardiac pacemakers. A pacemaker is a small medical device that is surgically implanted into the chest to control abnormal heart rhythms, such as arrhythmia. This is done using low-energy electrical pulses to prompt the heart to beat at a normal rate. The evolution of the pacemaker began back in 1958 with the first pacemaker device shown here. This device was large and a box-like component. Through the years, the pacemaker has evolved into the 2008 version, which is still in use today. This device fits in the palm of your hand and contains two leads to be placed inside the heart. Although we have come a long way in the development of the cardiac pacemaker, there are still several significant problems with the device. First, the pacemaker has limited battery life of less than a decade. This means that another surgical procedure is required every time a pacemaker battery dies. This leads us to the next problem with current pacemakers, which is surgical complications. Because this is an invasive surgical procedure in the chest and abdomen area, the patient is exposed to many surgical complications, including infection, allergies to the anesthesia and medications, and general surgical problems. And the more the patient is subjected to these surgeries, as in the case of limited battery life, the higher the risk of these complications during surgery. The last conundrum that befalls current pacemakers is the limited data they provide to the medical professionals as well as the user themselves. Living in the age of the Internet of Things, it is surprising that an advanced medical device would not have wireless data transmittance capabilities. This brings us to the cardiac pacemaker revolution, which is the miniaturization of the cardiac pacemaker. Medtronic, a prominent medical device company, has innovated a pill-like capsule that contains all of the components of a cardiac pacemaker. As shown here in the video, the pacemaker capsule is threaded through a catheter in the veins and is ultimately deposited inside of the ventricle. The catheter procedure is a well-established, awake patient procedure with minimal complications. The miniaturization of the cardiac pacemaker solves several of the problems with current models of the pacemaker. The battery life is approximately the same as a standard pacemaker, but surgery is not required. Because catheter implementation is a non-surgical procedure, the risks and complications associated with the implementation of the pacemaker are significantly reduced. Also, a feature of the miniaturized cardiac pacemaker is that it provides real-time cardiac monitoring and wirelessly transmits data, either to a bedside monitor or, in the future, even to the smartphone of the medical professionals or the user. In this image, you can see how incredibly small the revolutionized cardiac pacemaker is and how significant this innovation is in the medical device industry. A few of the design features that make the miniaturized cardiac pacemaker truly unique and truly revolutionary include its method for interchangeable positioning. Doctors currently make fine-tune adjustments by moving the pacemaker and leads around during the surgical implantation. This is necessary to ensure optimum placement for the best measurement of the heart's activity as well as low electrical thresholds. Thus, the miniaturized cardiac pacemaker was designed so the device can be pulled back into the catheter and placed somewhere else in the ventricle. Another design feature is that the device affixes to the heart. Whereas traditional pacemakers have leads going into the heart, the revolutionized device is completely inside the heart. The device is non-lead based, so another method of fixation was necessary to keep the device in place. Small nitinol wires were developed to grip the heart, keeping the electrode in and the device in place within the ventricle. The size of the cardiac pacemaker has been mainly limited by battery size in previous years. An efficient current drain was developed because it was necessary to have a battery life at least equal to the current pacemakers on the market. The current drain was thus adjusted in terms of making the circuit extremely efficient, so a small battery could be implemented within the device. In addition to the revolutionary design features implemented in the device, the miniaturized cardiac pacemaker includes all current features available in commercial pacemakers, including the same cardiac ranges, the same automaticity, and the same sensor to control the rate of patient activity. You may be wondering how this is an application of neural engineering. Many of the design challenges faced by those miniaturizing the cardiac pacemaker are also issues in the field of neural engineering. The pacemaker, like many neuroengineered devices, must be implemented in the human body, which is a particularly hostile environment, and must be impervious to biological fluids, while not causing a rejection reaction. The biocompatibility and engineered biomaterials are essential for the success of these devices. The stability and flexibility of wires must be maintained in the mechanical design of both pacemakers and neural devices. And finally, the electronics and programming technology behind the pacemaker shares key components and capabilities in neural devices. Specifically, the revolutionary efficient circuit system design of the miniaturized cardiac pacemaker is a technology capable of transforming many fields of biomedical engineering, especially neural engineering. The intersection of medicine and engineering technology into the solution of the miniaturized cardiac pacemaker can be extended into many applications within the field of neural engineering. Thank you for listening.